Okay, let's unpack this. We're diving into a topic that's becoming, well, incredibly relevant as artificial intelligence weaves its way deeper into our lives,
Hmm.
especially in something as critical as healthcare.
Absolutely.
The big question we're tackling today is how we understand how these sophisticated AI systems are making their decisions. The reasoning behind it all.
Exactly. And we've been looking at excerpts from a piece called Explainable AI, Building Trust in Healthcare Decisions,
Right.
specifically drawing insights from a section titled Epi020, The Unseen Logic, Explainable AI Demanding Transparency and Building Trust in Life and Death Decisions.
Okay.
And this source, it gives us a fantastic window into the current thinking, reflecting where things stood around, say, May 30th, 2025.
Got it. So our mission with this deep dive really is to go beyond just saying, okay, AI can be accurate in healthcare. That's sort of known.
Sure.
We need to understand why things like transparency, trust, accountability, why they're absolutely essential when AI is influencing potentially life and death decisions. We're really trying to pull back the curtain on what people call the AI black box problem.
And black box is, it's a perfect metaphor for the core challenge here. I mean, imagine an AI system, maybe in an ICU,
Okay.
analyzing just floods of real-time patient data vitals, labs, history, everything, and then it recommends a certain action.
Right, and maybe that recommendation is, I don't know, unexpected, perhaps even seems counterintuitive to the experienced doctors and nurses.
Precisely. The clinicians, they see the AI's output the what, suggests treatment X or predicts risk Y,
Mhm.
but they don't see the internal steps, the specific mix of data points, the complex algorithm stuff,
Yeah.
the why that led the AI there.
It's just hidden inside that opaque black box.
Exactly.
And this isn't just some far-off future scenario, is it? I mean, the source makes it clear AI is already being integrated right now.
Oh, absolutely. This is a present reality we need to grapple with.
Which really forces us to confront that central question. When the stakes are literally life and death, is just getting the right answer from an AI good enough?
Yeah.
Or is understanding the reasoning, the rationale behind its advice actually non-negotiable?
It certainly feels like you'd need the why, doesn't it?
Yeah.
And the source really builds the case for why that gut feeling is, well, critical in medicine.
Okay, let's get into that.
Absolutely. Now, first, it's important to acknowledge the, frankly, incredible power these modern AI systems bring. We're talking deep neural networks.
Right, the really complex ones.
And what they can do in healthcare. The source highlights some truly revolutionary stuff that's already happening based on that May 2025 perspective.
Oh, without a doubt. Things like AI completely changing medical imaging, right?
Yeah.
Spotting tiny, subtle signs of disease way earlier than a human eye might catch them.
Yeah, early signs of cancers, eye conditions,
Yeah.
things where early intervention is key.
Huge. And predicting patient risk, too.
Yes, becoming incredibly good at identifying who's most likely to develop, say, sepsis or have a cardiac arrest. This allows clinicians to step in proactively.
Makes sense. And drug discovery, I hear that's another big area.
Massive. AI can sift through just billions of potential drug candidates, identifying promising ones way, way faster than traditional lab work.
Wow.
And even tailoring treatment plans, using vast data sets, maybe genomics, to create truly personalized medicine. These aren't small things. They're huge potential leaps for patient outcomes.
So, okay, the power is undeniable. We get that. But it's that very complexity, the thing that gives it the power, that also creates the problem, the opacity, the black box.
That's the trade-off, often.
And when these super powerful but opaque systems get used in really critical healthcare moments, the source points out some pretty significant dangers, perils even.
Let's dig into those. One of the most immediate sort of practical perils is just trust. Trust and adoption by clinicians.
Right. Because if you're a doctor and this AI spits out a recommendation that just doesn't quite track with your experience,
Yeah.
and you can't see why it's saying that, especially if it contradicts your gut feeling or training, you're going to hesitate, surely.
Absolutely. You'd be naturally reluctant to just blindly follow it.
Mm.
And that reluctance means these potentially amazing tools might just, sit unused.
Or underused.
Yeah.
Which negates the whole benefit.
It's a major hurdle for actually getting these things integrated effectively.
Okay, so beyond trust, what about when things go wrong? Because let's face it, no model is perfect.
That's a critical point.
Yeah.
If an opaque AI makes a bad call, a wrong diagnosis, a harmful recommendation, and you can't see its reasoning.
Then how do you figure out what went wrong?
Exactly. You can't pinpoint the faulty logic or maybe the specific weird data point that threw it off.
Which makes fixing it, debugging it, or even just stopping it from happening again really hard.
Incredibly difficult. Seems almost unacceptably risky in a medical context, doesn't it?
It really does. And adding to that risk, the source talks about the data these things learn from. That's a whole other can of worms.
Yes. These AI models train on enormous data sets. And the reality is, those data sets can reflect historical biases that already exist in healthcare data.
Biases related to race, gender, socioeconomic status, things like that.
Precisely. And an opaque AI, a black box, can learn and actually perpetuate these biases without anyone realizing how or why it's doing it.
So it could end up leading to worse care or misdiagnoses for certain groups of people, and you wouldn't even know.
It could absolutely exacerbate existing health inequities. And the opacity means you might not detect it until real harm is done. That's a major ethical red flag.
Wow. Okay. What else?
Well, another big one the source highlights is the legal and regulatory side, accountability.
Ah, right. If a patient is harmed by an AI recommendation, who's responsible?
Exactly. Is it the doctor who acted on it? Is it the company that made the AI?
Yeah.
The hospital that implemented it?
Without transparency into why the AI made that specific recommendation.
It becomes incredibly complex legally to assign responsibility. It creates this kind of accountability vacuum.
That makes sense. And there was one more point, something about discovery.
Yes.
Yeah.
A lost opportunity for scientific discovery. Think about it. If an AI spots some really surprising connection, maybe a novel predictor for a disease,
Okay.
but we have zero insight into how it found that connection, we can't learn from it, we can't validate it, and potentially uncover new medical knowledge.
Sure, the AI might stumble onto something brilliant, but because it's a black box, that insight just stays locked inside?
Pretty much.
Yeah.
We can't extract and build on that potential new understanding.
Mm.
The source is really clear. In medicine, maybe unlike some other fields, the how and the why are often just as important as the what.
Okay, so this all points towards needing something different, which brings us, I guess, to explainable AI.
XAI.
Exactly, XAI. It's basically a collection of methods, techniques aimed at making AI decisions and predictions understandable to us humans.
Making the logic visible.
The core goal is to transform those black boxes into something more like glass boxes, to reveal the inner workings, the reasoning, in a way that users can actually grasp. But crucially, it's not always about dumbing down the AI model itself, right? Because that could reduce its power.
That's a key point. It's often about providing an explanation alongside the AI's output, rather than necessarily simplifying the core model.
Okay. And the source breaks down these XAI approaches into a couple of broad types, using analogies.
Yeah, which is helpful. Let's run through them. The first main category is post hoc explanations.
Post hoc, meaning after the fact.
Exactly. These techniques are applied after the AI has already made its prediction or decision to try and explain it.
Okay, like what?
Well, a really common one is feature importance. This basically tells you which specific inputs.
Like age or our lab result.
Yeah, exactly. Patient's age, a specific blood test value, a symptom they reported. It identifies which of those factors had the most influence on the AI's final conclusion.
Ah, the source had a good analogy here, like a doctor explaining a diagnosis.
Precisely. The doctor says, okay, based on the fever, the high white count, and this shadow on the x-ray, we think it's pneumonia. They're highlighting the key factors.
And there are specific methods for this, like S-shape and Lyme.
Yep, those are technical examples of algorithms designed to calculate this feature importance for complex models.
Got it. What else in post hoc?
Another one, especially good for images, is saliency maps.
Right, the heat map thing you mentioned earlier.
Exactly. If an AI analyzes, say, an X-ray, a saliency map visually highlights the specific areas or pixels the AI focused on most when making its decision.
So on a lung scan, it might light up a suspicious nodule.
Precisely. It shows you the hotspots the AI found most relevant. Very intuitive for visual data.
Makes sense. And there was one more, counterfactuals.
Yes, counterfactual explanations. These are interesting. They explore what-if scenarios.
How so?
They show you the minimal change you'd need to make to the input data to get the AI to produce a different outcome.
Okay, give me an example.
So the source example is great. AI predicts high heart attack risk. A counterfactual might say, well, if the patient's LDL cholesterol had been 50 points lower, or if their systolic blood pressure was under 120, then the AI would have predicted low risk. It pinpoints the critical thresholds in the model's logic for that specific case.
Ah, okay. That tells you which factors were really driving that specific high-risk prediction.
Exactly. So that's post hoc. The other main category is building models that are interpretable models from the start, sometimes called interpretable by design.
So the model itself is easier to understand.
Fundamentally, yes. Think about simpler models, things like decision trees or linear regression.
Decision trees. Those are the flowcharts with if-then rules.
Right. You
Yeah.
could literally follow the path of logic. Very transparent. Linear regression just shows how different factors are weighted. Simple, clear relationships.
But what about the really powerful, complex models, the neural networks? Can they be made interpretable by design?
Well, not fully transparent like a decision tree, but the source mentions things like attention mechanisms. Within deep learning, these mechanisms can show which parts of the input data the network paid more attention to as it processed information. It gives clues about its focus, even if the whole calculation isn't crystal clear.
So not a full explanation, but a hint at the reasoning.
Kind of, yeah. And finally, there are rule-based systems.
Which are?
These are systems explicitly programmed with rules defined by human experts. Like, if patient has symptom A, NED lab result B is high, then suspect condition C. The logic is totally transparent because humans wrote it.
But maybe less flexible, less able to find totally new patterns.
That's often the trade-off, yes.
Yeah.
Very transparent, potentially less adaptive or powerful on complex novel patterns compared to, say, deep learning.
So the big picture here is that XAI isn't just one thing. It's like a toolbox.
That's a great way to put it.
And you pick the right tool depending on the AI, what it's doing, and who needs the explanation. The doctor, the patient, the regulator.
Precisely. It's context dependent.
And this isn't just, a cool technical challenge for researchers. The source really hammers home why XAI matters across the board for everyone in healthcare.
Absolutely. It's presented as, like, the foundation for building a trustworthy system where AI is integrated. Let's take clinicians. For them, XAI is vital.
For building that trust we talked about and using AI safely.
Yes. If they understand the why behind an AI suggestion, they can evaluate it critically. They can combine it with their own knowledge. They can spot potential errors more easily.
And importantly, feel confident deciding whether to follow the AI or override it based on their clinical judgment plus the explanation.
Exactly. It changes the AI from this kind of mysterious oracle into more of a collaborative partner, an intelligent assistant they can actually work with.
Makes sense. And what about for patients? This feels really important.
Fundamentally about empowerment, right? Patients deserve to understand decisions affecting their health, especially when complex tech is involved.
So XAI helps with informed consent, building their trust in the process.
Yes, and helping them understand their own condition or treatment plan better. Plus, it gives them a basis to ask questions, to challenge things if they're worried about, say, potential bias or errors affecting them.
Oh, okay. Moving up a level, what about regulators and policymakers?
For them, XAI is almost non-negotiable for proper oversight. How else can you effectively audit these complex systems?
Right. You need XAI tools to check if an AI is fair, if it's safe, if it actually works as intended across different groups.
And to establish clear rules for accountability when something goes wrong, it's essential for setting standards for trustworthy AI development and deployment in such a high-stakes field.
And interestingly, the source also says XAI is valuable for the AI developers themselves.
Yeah, it's not just something imposed on them. It actually helps them do their job better.
How so? Debugging.
Definitely. Understanding why your model made a mistake is step one in fixing it. XAI helps identify hidden problems, including those bias issues we discussed.
So it helps them improve the model's reliability and robustness.
Exactly. And it fosters a culture of building AI responsibly from the ground up, not just powerful, but trustworthy.
So XAI really does seem like, as the source put it, a linchpin. It connects and enables everyone involved.
That's the argument, yes. But it's not all smooth sailing. It's important to acknowledge this is still an evolving field. There are real challenges.
Okay, like what? That trade-off you mentioned earlier probably comes up. Complexity versus interpretability.
That's a big one. Often the most powerful predictive models are the most complex. Making a model highly interpretable sometimes means sacrificing a tiny bit of that raw predictive power.
So finding the right balance is key.
It is. And it might vary depending on the specific medical task.
What else? The explanations themselves.
Yeah.
They need to be actually useful.
Exactly. Getting explanations that are truly contextual and clinically relevant. An explanation might be mathematically correct, but totally useless to a busy doctor if it's not presented clearly, quickly, and in a way that fits their workflow.
Needs to be tailored to the user.
Absolutely. User-centered design is crucial.
And how do you even measure if an explanation is good? Standardization.
That's another hurdle. Standardization and evaluation. We lack universally agreed upon ways to measure explanation quality or usefulness. Makes it hard to compare different XAI methods or ensure consistency.
And privacy, always a huge issue in healthcare.
Critical. Data privacy and explanations. The explanation needs to reveal the logic without revealing sensitive patient data used for training or for that specific prediction. That's a very delicate balancing act.
Makes sense. Plus, just the human factor. Can doctors easily understand and use these explanations?
Right, the human factor. If the explanation itself is confusing or poorly designed, it could actually add more work, more cognitive load for the clinician.
So good design and maybe training are needed there too.
Definitely. But despite these hurdles, the source is optimistic. As of 2025, it notes there's a lot of active research, collaboration between academics, industry, doctors, ethicists, regulators.
People are working on these challenges.
Yes. They're pushing XAI methods forward, trying to develop better standards. It's seen as a really vibrant and important area of work.
So, okay, reflecting on everything the source laid out, where does this leave us? It feels like we're at a really pivotal moment. AI in healthcare is happening. The potential is huge.
Immense potential, yes. But the source makes a really strong argument. Just being accurate, just having technical skill isn't enough when you're dealing with people's health.
Explainable AI isn't just a nice-to-have feature.
It seems to be presented more as an ethical necessity,
Yeah.
a practical requirement for building real trust.
Because that trust, it doesn't just come from knowing the AI is usually right. It comes from transparency, understanding the process, and knowing there's accountability.
Exactly. Without that understanding of why the AI is making its recommendations, the whole foundation feels, well, potentially fragile, especially in high-stakes medicine.
So transparency builds trust.
Trust enables collaboration.
And that collaboration between human expertise and AI capabilities, that's where the real power to transform healthcare lies.
That seems to be the core message. And it's not just on the developers.
Yeah.
The source emphasizes that everyone, patients, doctors, researchers, policymakers, we all have a role in demanding and fostering this explainability.
Which brings us to that final thought, building on the source. It really makes you think personally, doesn't it? How comfortable would you, the listener, actually be if a major medical decision about your own health was heavily influenced by an AI whose reasoning was just a complete mystery?
Yeah. What level of explanation would you need to feel genuine trust in that AI-influenced decision affecting your life? It's a really important question for all of us to consider.